Welcome to the 6th annual Tech Savvy and STEM-tastic regional event for middle school students. The pandemic this year has prevented us from being together on the University of Jamestown campus like we have in the past. We do look forward to being back on campus next year in 2022. My name's Jim Bear, and I'm from the University of Jamestown, and I am happy and excited to be part of this event. I would like to recognize the sponsors that did make this possible, including Montpelier Public School, University of Jamestown, Gateway to Science, the North Dakota STEM Ecosystem Grant, and AAUW. Our sponsoring organizations help fund our supplies, they recruit our STEM professionals, they do the video editing, and really take care of everything that you see happening here today. STEM is a relatively new emphasis in schools, but STEM careers, such as the careers Doctors Matheson and Bond will soon be speaking about, have been a part of our community for many years and are a normal part of our lives. This year's event has gone online with 4 in-classroom videos by STEM professionals with hands-on activities. I want to thank this year's STEM professionals from Ducks Unlimited, Microsoft, Apex Engineering, and Lifetime Vision. Prior to viewing any videos or activities, please be certain that you have completed the pre-survey information of which has been given to you. The upcoming presentation is by Doctors Matheson and Bond of Lifetime Vision right here in Jamestown. The activity information has been provided to schools, and that is something that you will take part in once you are done watching the video.
Hi, I'm Dr. Tamara Matheson.
And I'm Dr. Brianna Bond.
We're at Lifetime Vision 2020 in Jamestown. We're optometrists, and we're going to give you a little sneak peek at what we do during our day. I'm sure many of you have been to an optometrist and have an idea of what we do. While providing vision exams is certainly one of our most common daily tasks, we can and do so much more. And that's one of the things I love about being an optometrist. My daily tasks can be quite varied and challenging, and my patient interactions in a day can range from routine vision exams, evaluating a child who is not performing well in school, diagnosing a patient with systemic disease like diabetes or hypertension to stroke or tumors, managing the care of a contact lens patient, providing an infancy exam, which is an eye assessment to infants 6 to 12 months old, assessing the vision skills of an athlete to enhance their performance, prescribing medications for glaucoma, providing follow-up care after cataract surgery or refractive surgery, removing a foreign body from the cornea. I have chosen to practice general optometry, which means I can see and treat all of these vision and eye health concerns. But in the field of optometry, there's also the opportunity to specialize in any one of these areas. Bottom line, I think, is if you like to problem solve and interact with people, then I encourage you to consider a career in optometry. Assisting me to provide this care is the help of a couple key members of our care team. First is my ophthalmic assistants or technicians. In most offices, the first person to interact with the patient in the clinic is an ophthalmic assistant. They are key in gathering and updating all patient information and preparing the patients to be seen by the doctor. This will include performing preliminary testing like visual acuities, pupil testing, intraocular pressures, color vision, and using technology and instrumentation for specialty testing like retina photos, retina scans, and visual fields. They can also be trained to assist the doctor in special procedures and educate the patients on recommendations and treatments prescribed by the doctor. Ophthalmic assistants most commonly are hired and trained in the office, but there are online certification programs or even in-person programs at vocational schools, technical institutes, or community colleges. Now that Cody has performed all the preliminary tests on Jaden, he's ready for Dr. Bond to examine his vision and eye health. Here you see the exterior part of his eye, his iris, his eyelids, and next we're going to take a look all the way to the inside of the eye and seeing his retina and his optic nerve and blood vessels. always amazing. The opticians are the other key member of our care team. So the opticians get to help the patients with what we refer to as kind of the fun part of the patient experience, picking out new glasses. While this job may seem more in the line of sales and fashion, there's actually quite a bit of physics and math involved. I've asked our optician Brad to explain how an optician uses math and physics on a daily basis.
My name is Brad and I'm an optician. Today we're going to talk about how we use math in the real world. There's lots of different ways we can use math, but what I do on a daily basis is I help people see, and I try my hardest to help them see the best they can. We have a good team here and we all work together to help people on a daily basis. There is so much math that is involved with eyeglasses that it actually is kind of interesting for me to record this video for you. I'm learning again with you. It's not just about wearing cool sunglasses, and it's not just about wearing the latest designer frames. We want to help you see so well that you'll love coming back. Opticians are constantly figuring out how well glasses will fit our patients. To do this, we use secret formulas all day long. After you see the eye doctor, your eye doctor will give us your new prescription. Then we can start to calculate how thick your lenses will be or how thin your lenses will be. Sometimes you've seen kids with thin lenses, and sometimes you've seen kids with thicker lenses. It's all based on how you see. We calculate additional things like a pupil measurement, how far apart your eyes are, and that helps us make your lenses so that they are specific for you. We also can calculate your frame size so that we know what's going to fit you the best and give you the best performance. So all those things have a little bit of hidden math. But what's really neat is the opticians can help you find lenses that will look the best in your frame. Sometimes we refer to those as indexes of refraction, and so this lens is a little thicker. It'll bend light just a little differently than this lens. Some of you may not need glasses every day, but you may need a little help when you're studying, when you're reading, when you're gaming, things like that. We have some options here that can help you see. So sometimes we'll ask you questions like, how far away are you reading? Are you reading this close, or is your monitor this far away? All those things can help us determine what is going to be the best fit for you. The further away, you would need a little less power, and we can calculate that. The closer you are, we might need a little more power. What's so interesting about working as an optician is that I get to use many different types of math each and every day. I figure percentages for discounts when people pay for their glasses. We use addition and subtraction as well. We use multiplication and division. It seems like we use math way more than I ever realized. Sometimes we help prepare budgets, which is a different type of math. We forecast sales. We even use a bit of physics from a day-to-day basis when we talk about how light is being bent. So, girls, it was a pleasure to do this video for you. I hope you have a wonderful day. Thank you.
Opticians, like ophthalmic assistants, are most commonly hired and trained in the office, but again, there are online certification programs and in-person education at vocational schools, technical institutes, or community colleges. The activity we plan for you is testing your visual field or peripheral vision. Peripheral vision is important in our everyday lives because it allows us to gather a visual sense of our surroundings. Without it, we would see the world through tunnel vision. Almost everything we do, from riding a bike to dribbling a basketball to reading a book or driving a car, depends on peripheral vision. In this activity, you will make or use a prepared vision protractor. Your teacher will guide you through the activity. If time allows, test your peripheral vision using different shapes and colors. What color does your peripheral vision respond to best? What color is the hardest to see using your peripheral vision? This is Dr. Tamara Matheson, thanking you for the opportunity to share this with you. Everyone at Lifetime Vision, wishes you the best as you explore careers in science, technology, and mathematics.
It's interesting to me to see some of the inside workings of Lifetime Vision. I've been getting my glasses there for as long as I can remember. So once you've completed the activity, please be certain that you do complete the survey that is related to this particular presentation.